Hi, so today is Overdose Awareness Day, and I just wanted to talk to you about what to do if you come across somebody that may have overdosed. Well, whether they're unconscious, normally they are often. The number one thing is don't panic. I know we say that a lot, but seriously, don't panic. The next step is ring the emergency services. Now, there are three numbers you can call, and all will work regardless of whether you're in the UK or the US. If you're in the US, the number one thing to call obviously is 911. However, in the UK, the number one number to call is 999, always 999. But what we also know is in this country, you can also call 112. These will all get you the emergency services. Now, don't worry, if you're in the UK, you can also call 999, 911, or 112. And if you're in the US, you can also call 999 or 911. These will all connect to the emergency services. So we've got the emergency services called. You've got a person in front of you. What do you do? Check their airways. Make sure they can't choke on anything. And it is as simple as head back by tilting the chin and check. Make sure there is nothing blocking their airways. Number one, especially if you see any vomit, check to make sure there is nothing in there. If there is, they need to be put on their side. The second part is to always put them in the recovery position. This will help to prevent, if they vomit, choking on their own vomit. And you want to make sure that they're put on their left-hand side. I'll explain that in another video, why we put them on the left-hand side. And then what you do is stay with them. Keep talking to them, keep calm, make sure they're breathing, make sure they're warm. If they're vomiting, keep an eye on them that they don't choke. If you can, look around, but don't leave them. Look around, see if you can see what they've taken, because the more information you can give the ambulance crew, the better. Try to make note of the time so you know kind of how long they've been down, things like this. And then when they have been treated, they've gone off with the ambulance crew, whatever, however it's done, get yourself some therapy so that you don't get affected by the trauma of finding and having to help somebody who's overdosed. This has been Thoughts with Points, and if you're thinking of overdose, please talk to someone. Take care.